Good evening, and welcome to Crossfire Debates, our weekly program dedicated to dissecting the most pressing issues of our time. Tonight, we delve into a question that touches every citizen. Should universal healthcare coverage be guaranteed to all residents of a country? With us to explore this complex topic are two distinguished guests. Arguing in favor of universal healthcare is Dr. Ben Carter, a renowned public health expert. Presenting the arguments against is Ms. Lena Hansen, an esteemed economist and policy advisor. We will begin with opening statements, followed by a moderated discussion, and conclude with closing remarks from each speaker. This is a vital conversation, and we anticipate a robust and enlightening exchange of views.
Thank you, Isabel. Good evening. I stand before you today to advocate for a principle I believe is fundamental to a just and prosperous society: universal healthcare coverage for every resident. This is not merely a policy preference, it is an ethical imperative. Access to healthcare should never be a privilege dictated by one's income, employment status, or social standing. It is a basic human right. When we guarantee healthcare for all, we foster a healthier population. Preventative care, early diagnosis, and timely treatment become accessible to everyone, significantly reducing the burden of chronic diseases and improving overall public health outcomes. Consider the societal benefits. A healthy populace is a more productive populace. When people are not burdened by the fear of medical bankruptcy or the inability to seek care, they can contribute more fully to our economy and our communities. Furthermore, universal healthcare systems are often more efficient in the long run. By investing in preventative measures and ensuring everyone has access to primary care, we can avoid the exorbitant costs associated with emergency treatments and unmanaged chronic conditions, which disproportionately affect those without consistent coverage. Opponents often raise concerns about cost, but I argue that the cost of inaction, the price we pay in diminished lives, lost productivity, and escalating emergency care is far greater. Many developed nations have successfully implemented universal healthcare systems, demonstrating that it is an achievable goal. It's about building a society where illness does not automatically lead to financial ruin, where children can grow up healthy regardless of their parents' income, and where we collectively ensure that everyone has the opportunity to lead a healthy life. This is the compassionate, sensible, and ultimately the most economically sound path forward.
Thank you, Isabel. Good evening. While the aspiration of ensuring everyone has access to healthcare is undoubtedly noble, and one I share, the specific proposal of guaranteeing universal healthcare coverage through a state-mandated system presents significant practical and economic challenges that we cannot afford to overlook. My primary concern revolves around the immense economic burden such a system would impose. Guaranteeing healthcare for all residents invariably means a substantial increase in public expenditure, which must be financed, typically through higher taxes on individuals and businesses, or through significant national debt. This level of taxation can stifle economic growth, discourage investment, and reduce disposable income for families. Moreover, large-scale government-run programs are often susceptible to inefficiencies and bureaucratic hurdles that can escalate costs without a corresponding improvement in care quality. Furthermore, we must critically examine the potential impact on the quality and accessibility of healthcare services. In many countries with universal systems, patients face lengthy wait times for specialist appointments and elective surgeries. This rationing of care, whether explicit or implicit, can have serious consequences for patient outcomes. The argument for individual responsibility also needs to be considered. While societal factors play a role in health, personal lifestyle choices are significant contributors. A system that fully insulates individuals from the financial consequences of these choices may inadvertently discourage healthier behaviors. Finally, a monolithic, government-controlled system can stifle innovation and limit patient choice. Competition and market forces have historically driven advancements in medical technology and service delivery. Reducing these dynamics could lead to a less responsive and adaptable healthcare sector. Therefore, I believe we must explore alternative solutions, perhaps targeted subsidies, market-based reforms that enhance competition and transparency, and support for preventative health initiatives that aim to expand access and affordability without dismantling the current framework or imposing an unsustainable fiscal burden. It's about finding a balance.
Thank you both for your compelling opening statements. Dr. Carter, Ms. Hansen raises significant concerns about the economic burden. How would you propose funding a universal healthcare system sustainably, and what is your response to the argument that it could stifle economic growth?
That's a valid question, Isabel. Firstly, many countries with robust universal healthcare systems fund them through a mix of progressive taxation, payroll contributions, and sometimes dedicated levies. The key is designing a system that is fair and doesn't disproportionately burden lower-income individuals. Regarding economic growth, a healthier workforce is a more productive workforce. Reduced absenteeism due to illness and greater financial security for families can actually stimulate economic activity. Moreover, current systems where healthcare is tied to employment can hinder entrepreneurship and job mobility. Universal coverage decouples these, potentially boosting innovation.
If I may, Dr. Carter, while the idea of a healthier workforce is appealing, the transition costs and the sustained high levels of taxation required are often underestimated. Many European countries with such systems have significantly higher tax-to-GDP ratios than, for example, the United States. This can make a country less competitive internationally for businesses and talent. Furthermore, government allocation of vast healthcare resources can be less efficient than market-driven allocation, potentially leading to misdirected investment and slower adoption of cost-saving technologies, if not carefully managed.
Ms. Hansen, you also mentioned concerns about wait times and patient choice. Could you elaborate on how universal systems might negatively impact these aspects of care?
Certainly. When healthcare is provided as a universal entitlement, often with fixed governmental budgets, demand can easily outstrip supply, particularly for specialized treatments or elective procedures. This inevitably leads to queuing, or what we call wait times. Patients might find their choice of doctors or hospitals restricted compared to a market-based system where they can opt for different plans or pay out of pocket for quicker access or specific providers. This limitation can be frustrating and detrimental for those needing timely care.
While wait times can be a challenge in some universal systems, it's often a matter of resource allocation and system design rather than an inherent flaw of universality itself. Many systems actively work to manage wait lists effectively and prioritize urgent cases. Moreover, universal systems excel at providing equitable access to primary and preventative care for everyone, which is often lacking in purely market-driven models where many go without. This focus on prevention can reduce the need for more complex, expensive treatments down the line, ultimately improving overall health quality for the majority, not just those who can afford premium access.
Dr. Carter, you framed universal healthcare as an ethical imperative. Could you expand on the broader societal benefits beyond just health outcomes?
Absolutely. Beyond the direct health benefits, universal healthcare fosters greater social cohesion and reduces inequality. When a society collectively ensures that its members are cared for in times of illness, it sends a powerful message of solidarity. It mitigates the risk of medical debt, a leading cause of bankruptcy in some nations, thereby providing economic security and reducing stress on families. This allows individuals to pursue education, change careers, or start businesses without the fear of losing essential health coverage, leading to a more dynamic and equitable society.
From an ethical standpoint, however, one must also consider the principle of individual liberty and responsibility. Compelling all citizens, regardless of their personal health choices or financial capacity, to fund a monolithic state-run system raises questions. Is it ethically justifiable to heavily tax a young, healthy individual who maintains a healthy lifestyle to subsidize the care for those whose health problems may stem from personal choices? Furthermore, limiting choice in healthcare providers or treatments, which can happen in some universal models, also touches upon ethical concerns about autonomy. In conclusion, while the goal of accessible healthcare is shared, mandating universal coverage through a state-run system presents formidable challenges. We've discussed the significant economic burden, the potential for increased taxes, and the risk of stifling economic dynamism. Concerns regarding reduced patient choice, longer wait times for non-urgent procedures, and the inherent inefficiencies often found in large public bureaucracies remain pertinent. Furthermore, the principle of individual responsibility and the ethical considerations of compelling universal participation cannot be dismissed lightly. I believe a more prudent path involves targeted reforms that enhance affordability and access within a competitive, multi-payer framework, fostering innovation and choice, rather than a complete overhaul towards a single-payer, universal guarantee which may promise more than it can sustainably deliver.
To summarize, universal healthcare coverage is not a panacea, but it is a moral imperative and a practical necessity for a thriving society. The arguments for are compelling. It ensures healthcare as a right, not a privilege, leading to better public health outcomes for everyone. It fosters economic stability by preventing medical bankruptcies and creating a healthier, more productive workforce. While challenges exist in implementation, numerous countries demonstrate that these can be overcome with careful planning and political will. Ultimately, the question is what kind of society we want to live in. I advocate for one that prioritizes compassion, equity, and the well-being of all its citizens by guaranteeing that essential medical care is available to every single person, regardless of their ability to pay.
Thank you, Dr. Carter, and thank you, Ms. Hansen, for this rigorous and insightful debate. You've both presented strong arguments that highlight the complexities surrounding universal healthcare coverage. We've heard compelling points on the ethical obligations, economic implications, potential impacts on quality and access, and the fundamental questions of societal values and individual responsibilities. There are clearly no easy answers. We hope this discussion has provided our audience with a deeper understanding of the different perspectives and encourages further reflection on this critical issue. Thank you for joining Crossfire Debates. Good evening.